So we're about 6, 7 months now with COVID, and my experience both in Burbank and what I've seen here. We know how to care for COVID-19, and I think we've learned a lot since March, April, to where we are today. What I think we've learned is mostly surrounded how do you keep our caregivers and patients safe, and personal protective equipment that today now feels normal, wasn't normal 6 months ago, and how do you interact with that? COVID-19 is an infectious disease. We're actually familiar with how to care for infectious disease. We've had these in the hospital before, but we do know more today of how to care for it. I think from where I see the changes moving forward is in the technology of how people get their care. This has really provided an opportunity for many people to move towards virtual care. We've done it now in our own business world, and we're seeing it down on the patient world. So when I think about Providence has done thousands and thousands of virtual visits now, where today is starting to feel more normal. And so we're seeing that both in people using our Providence Health Connect or other virtual care apps that we have that then really allow them to get their care that they need. They don't even have to leave home. But for us, I think we've managed this patient volume. It's been fairly consistent lately, but we're starting to get comfortable with how we care for our patients. But safety has always been a priority. Changing our supply chain of how we get our personal protective equipment. I think we're far stronger today than we were 6 months ago.
What's the outlook for the hospital this winter? We keep hearing things that cases might spike because it's the natural flu season, or it's just colder, or these are just related factors. But what's the hospital see here over the winter and into next year?
So like you, I think we're monitoring what the next 6 months will look like. Add in the pandemic, add in the flu on top of it. We are prepared for it, but we're not sure what the next 6 months will look like. I think every time we see a holiday, we're cautiously watching to say, what does transmission rates look like? Our transmission rates are just starting to come down here in Thurston and Lewis counties, but that fluctuates from time to time, and so we'll continue to monitor for it. We are prepared from a surge plan that if we do get a surge, we're prepared for it. And right now, our personal protective equipment, what we call PPE, we've secured and feel very confident that we'll be ready for it.
Does that surge mean you also have enough beds for everyone if it comes to that?
So it means we have to come up with other places to see patients, but yes, we do.
And you see them, not just from Thurston,
Yeah.
but are you also seeing COVID patients from Lewis or Mason or Grace Harbor?
We are. So we have 5 counties, so Thurston, Lewis, Grace, Pacific, and Mason. And so what we've done is try to serve as a hub for those patients, just because of the intensiveness of resources and both the training of nurses, techs, and other physicians on how to treat the disease. Still have a no visitor policy in place today. We're working with Thurston County Department of Health. Actually, we meet with them weekly to review transmission rates to decide when do we want to make changes. Now, we have made changes to the no visitor policy. So, for example, end of life care, we know that that's an important time that we would want a visitor near their loved one. We also have learned in the 6 months that the role of what visitors play in healing for patients. And so we routinely keep looking at this policy, and probably will be making some changes. Other hospitals have. The criteria we're looking at is, one, do we have enough personal protective equipment for our visitors on top of our staff to keep them safe? And then 2, just wanting to make sure we don't have an outbreak within the hospital, within our own caregivers, so then they're not available to care for those that need us. So we have been a little bit more cautious than other hospitals, but I do suspect, actually there's a meeting later this week where they're looking at, and they meet about every 2 weeks to look at our transmission rates and when we can make changes. But I think as this pandemic continues, I expect to see some changes with that. Right now we're looking at a 52-bed expansion, and where that sits and how that fits within the hospital is being designed. But that will be open for all. And I think as we continue to see both Thurston County and Lewis County continue to grow, part of our mission is to make sure that we're meeting the needs of those that we serve. And as you know, we do have some capacity challenges in some areas, and so that's why this expansion is really critical for us. We are in the process of doing a joint venture with Fairfax and creating and building a behavioral health hospital. The needs are great here in this community and continue to grow. And then as we think about the care that's needed within a behavioral health patient, the acute care setting isn't the best place for that. And so we are kicking off that next phase, and so we should be in front of the city of Lacey here for a land permit hearing next month, and so we're gearing up for that. And then hopefully we would start construction in 2021 on the Lacey site. It'll be about 85 to 100 bed facility. Can't come online fast enough for taking care of our behavioral health patients. Our nurses are part of our Providence team. They're part of our family. They have delivered and continue to deliver excellent care. I'm always disheartened when we can't reach a compromise from a union standpoint, and then we have a strike in front of us. We want to maintain excellent relationships with our unions. That's an important part of who we are here within Olympia. But I recognize not every day we're going to be on the same page, and so we'll navigate through that as they present. But I do feel that our nurses are a valued part of our team. It's our largest workforce. We do want a great relationship with the union, and we do want to make sure that's all one family and how we care for patients. So having those relationships strong is helpful, but I recognize not every bargaining session we're going to see eye to eye on. I think
Where will the hospital be?
Well, I hope to be far underway with an expansion project. I do think we'll be far more educated on how to care and treat for COVID, although we've learned a lot in the first 6 months. I expect that we will understand that how to handle telehealth in different ways, and I think what is starting to see us switch into telehealth, I hope we even see more of it, and it's become just common.